Hi, I'm Vanessa and welcome to my YouTube channel, Words by Vanessa. Today is going to be a very interesting topic because it was of your choice and I'm so excited to present it to you. And most importantly, this is a topic that it's conducive to both men and women. So let's get started. I will be reading quite a bit of this because there's so much good information that I want to make sure I don't miss out on one single bit of morsel of information for you. So here we go. If you think urinary incontinence affects only older women, then you better think again, because it also affects young women and women that are active. Are you one of these women? This is an embarrassing problem, and lots of women, regardless of the age, are suffering with it. When I started doing my research a week ago, it states that between 25 and 45% of women actually suffer with this. And men, if you think that you're scapegoating this, then you better think again, because worldwide, it's 43 million of you that are suffering from it. So you better just tune in and listen. Dr. Linda Brubaker, who is a physician and a professor at the University of Loyola University in Chicago, she states that it's embarrassing for women. It really affects your quality of life. It affects your emotional state. It stakes your body image and also your sexuality. People don't realize that this is actually, urinary incontinence is a medical condition. They think that many women believe that it's what we're supposed to go through because we've had children through childbirth, through a vaginal delivery, obviously, or menopause. And the fact of the matter is, that is the furthest thing from the truth. There are steps that we can take in order to make this work, and they're simple and easy. So let's go through the 4 different types of urinary incontinence. They are stress incontinence. And stress incontinence is that little bit of leakage that happens when you cough, when you laugh, or when you sneeze. It's a result, like I said, from pregnancy, from having a vaginal childbirth, or also when muscles get stretched in your pelvic area or they're damaged. Urge incontinence, or better known as overactive bladder, it is an urgent need to go through, followed by an involuntary loss of a little bit of urine or quite a bit of urine, up to a few seconds or a minute. Mixed incontinence means that you have more than one type of incontinence. The most typical are the stress or the urge incontinence. And the last is overflow incontinence. If you can't empty your bladder every time you go to the bathroom and you experience either a constant or a frequent dripping of urine, then that is overflow incontinence. How do you know if you have urinary incontinence? Now, this is a serious topic, so I have to make it a little bit funny sometime. So this is what I think. And this is what I know from my girlfriends that have also experienced this. So you know when you're having a good time talking to your friends and you're laughing your ass off, and then all of a sudden you pee a little bit in your pants? That might be a sign. Or if you're working out, if you're at the gym doing step class, or you're running, or you're doing a cycling class, or you're even doing extensive weight training, and all of a sudden you pee a little bit in your spandex or your latex, guess what? That also might be a symptom. That might also be a reason. And there's also many other causes. So let me go through them with you. Hysterectomy for women, because of course it's a surgery and it is in there and part of your pelvic muscles. It might do a little bit of damage or a little bit of stretching. It could be menopause. For men, it's enlarged prostate or, God forbid, prostate cancer. It could also be being overweight. I mean, we have no idea how much it affects your body when you're overweight. Not only carrying the weight, but the amount of pressure that it goes through in your pelvic muscles. There are other diseases like Parkinson's, or it could be something hereditary, which I didn't even think about this. Hereditary means if your mother or your father have it, you could also have it as well. So it's good to keep focusing on this. The other thing that I always find very interesting is that instead of going to a doctor, talking to your friends and family and saying, this is what I'm experiencing, have you experienced this? Because although it is an embarrassing topic, it's so much better to take care of the situation now than it is to continue to experience the symptoms for a long period of time. And what happens with people when they have the symptoms, they might do things like stop drinking caffeine, because as we know, caffeine is a diuretic. So you are omitting coffee, you're omitting Coca-Colas and sodas, you're omitting, oh my Lord, alcohol. Could you imagine deleting alcohol from your everyday? Woo! Oh my Lord, that would not be good. For women, of course, in order to prevent having a little bit of leakage in your panties. You wear tampons. Men and women both wear the Depend, the big thick pads. These are things that have to do as a regard of having urinary incontinence. So let's talk about treatment options. Treatment options are far and few, but there are quite a few that are very conservative, and they can be from the most expensive to the least expensive. So we're going to start with the most conservative, least expensive, and work our way down. And I think it's also very important that as we discuss this topic, it's important to always keep in your mind, this program is all about information, about us taking it and sharing it so that we cut the learning curve in half. But this is a very serious medical situation. So it's important that you discuss it with your doctor as soon as you can. Let's discuss treatment options. We're going to start with the most conservative and least expensive and work our way to the most invasive and most expensive. Muscle training. What is that, you might ask? Learning to control your muscles. So for this example, we would use a Kegel, which will strengthen the muscles of your pelvic floor. The added benefits for doing a Kegel is that will enhance the quality and length of your orgasms, and there's never anything wrong with that. Bladder training, which is lengthening the time between trips to the bathroom. This can help women when it comes to urge incontinence. Electrical stimulation, which I think is very interesting. It's a small probe that's inserted into the vagina, which gives a quick dose of electrical stimulation into the vaginal walls. It gives you the same effect as the Kegel, so make sure that you look it up so you know exactly what it is. And then, of course, other options are hormone creams, medications, implants, even surgery. I hope through this you have gotten a little bit of information about urinary incontinence. Understand that you're not alone. By doing what we do here on this program, we take the information and we share it so we cut the learning curve in half. So make sure that you tell 3 people what you learned today and pass the information on. I hope that you enjoyed everything. And thank you so much, viewers, for sending in topics that you'd like to discuss. I really super appreciate it. I hope you guys have a fantastic week. Check in next Thursday, as we always do. Don't forget to subscribe and do a thumbs up if you like this, because it's very good for the show and it's very good for the program in general. And as I always tell you, don't forget to put a little love into it.